Hi, my name's Elizabeth. I'm going to be performing 4 special tests today. The first one is called the POTS compression test. And this test is used to determine if there's a fracture. So if there's pain at where the fracture is suspected, that's a positive test. So I'll have you straighten out your leg. And then where do you feel the most pain?
Just right here, I kind of bumped it.
Okay.
I was climbing the other day.
Okay. So what I'll do is I'll apply pressure like this, and we'll move closer to where you feel the most pain. And I'll just ask you like if you feel any pain.
Okay.
What do you feel when I do that?
I feel fine.
Okay.
I feel fine.
Okay.
That one hurt a little bit.
Okay. So as the pain increased as we got closer to it, that could indicate a fracture. So we'd recommend go get x-rays and things like that. Okay, the second test that I'll be doing is called the percussion test.
Okay.
And this one you also use if there's a suspected fracture. And if there's pain, again, that's a positive test. So we'll use the same spot. This is where you're suspecting a fracture. So I'll hold above, and then I'm going to tap below on your heel, and then you'll just tell me what you feel.
Yeah, I just felt a little bit of pain.
Okay.
But I feel like it was more spread out.
Okay. That could still indicate a fracture, so we'd recommend getting an x-ray.
Okay.
Okay. The fourth test that I'll be doing is called the Taylor tilt test. This one is used when there's a suspected calcaneofibular or deltoid ligament sprain. And so if there's like an increase of movement or laxity at the joint, that can indicate the sprain. So I'll have you scoot towards the end of the table. And I'm just going to be moving your foot into inversion and eversion, just testing to see how much your ankle moves. Okay, and then we'll test bilaterally to compare. Okay, and since both your ankles have the same amount of movement, there's not a suspected ligament strain, so that would be a negative test. Okay, the last test that I'll be doing is called the squeeze test. And this one is similar to the compression test that we did, but we're checking for a high ankle sprain. So a ligament sprain in the syndesmosis in between the tibia and fibula. So I'll have you scoot back with your legs straight, perfect. And so if we're suspecting a sprain here, I'm gonna apply pressure there. And if you feel pain, then that's a positive test. What do you feel?
I felt all right.
Okay, so that would be a negative test.
Hi, I'm Scottie Busher, and today I'll be performing or explaining 5 different tests that we have to analyze injuries. And the first test I'll be talking about and explaining is the long bone compression test. And for this test, the whole point is to see if there's a possible fracture site, or see if there's a possible fracture in the area. And right now we're talking about the lower limb, so the example I'm going to be using would be in the metatarsals, and I'm going to be talking about the second metatarsal. And for this test, the point is to put compression on the axis of the long bone. And to do that, your goal is not to put pressure or to touch the bone specifically, but the bones around it, and put that compression on there. And I'm going to grab and put my hand below your ankle or behind your ankle, and I'm going to put it on the proximal phalange, and I'm going to put the compression in there.
Oh dear! Oh, that's painful, Sonny. Oh.
And you can see he felt some pain there, and you felt pain, and that means that's just a good chance, and it's a positive test that there's a good chance that there's a fracture in your second metatarsal.
Yeah.
And a negative test would be if there's no pain there, if he doesn't feel anything. And the second test we're going to do, or the second test I'm going to talk about, is the Ottawa foot rules. And for this one, there's two things we're going to be looking at, and that is whether there's pain in that area, or if you can take 4 to 6 steps. And the area we're looking at is just in the foot, and you're in the foot area. So is there any pain in that area at the moment?
Yeah, there's a little bit of pain. Just kind of through here.
Okay, good to know. And next I'm going to have you try to take 4 to 6 steps.
Oh, Sonny, I really don't look good. Oh, dear.
So we're going to have you sit back down.
Okay. Oh, dear.
And that's a positive test because he could take 4 to 6 steps, and that's a good chance that he has a fracture. And the next rules we're going to talk about is going to be the Ottawa ankle rules, and the same 2 rules apply whether there's pain in that area and if you take 4 to 6 steps. And the area we're looking at is the distal 6 centimeters of the shank. And so same thing, is there any pain in?
I've had this strip something going on right about here. I'm not sure what it is though.
Okay, good to know. And we're gonna now try to walk again.
You fool. Don't you know how this turned out last time? Oh, great Scottie Busher! Oh, dear! Oh!
And since, again, it'd be a positive test since he couldn't take 4 to 6 steps, and that's the Ottawa ankle rules. We're just looking for those 2 things. And it'd be a negative test if he could take 4 to 6 steps and if there wasn't any pain. Or even if there was pain, then it's a good chance it's not a fracture. So the next test we're going to look at is the dorsiflexion maneuver test. And for this one, we're looking for a possible high ankle foot sprain. And it'd be a positive test if there's any pain in the syndesmosis area. So the first thing that I'm going to do is I'm not going to grab the lower part, the distal part of his ankle or of his leg, because that would be interfering with the test and seeing if it's positive or not, or accurate or not. So I'm going to grab the top part of his leg, and I'm going to push his foot into dorsiflexion.
Oh, my. Oh. Yeah,
Do you feel anything?
That didn't feel too good, Sonny.
Okay. And that's a positive test because as we pushed his foot into dorsiflexion, that he felt pain. Where do you feel pain?
It's right about through here. Kind of where that you told that syndesmosis thing was.
Okay. And since he had pain in the syndesmosis area, that's a good indication that he has a high ankle sprain, and it's a positive test. A negative test would be if there wasn't any pain at all. The next test we're going to talk about is the Thompson's test. And for this one, I'm going to have you lay on your stomach. And for this test, what we're looking for is a possible Achilles rupture. And a positive test would be, as I squeeze his calf, we're going to watch to see if his feet moves. And if I squeeze the calf and his foot moves like that, that is a negative test because the Achilles rupture his Achilles isn't ruptured. And the negative test, or a positive test would be, is as we squeeze his calf, his foot doesn't move, and it shows that his Achilles is ruptured. Yeah.
Hello, I'm Cannon Jones, and I'm with my lovely subject Elizabeth today. She's been feeling not so great, so we're going to be doing a few special tests with her today, specifically 4 different special tests. We're going to be starting with the vibration test, and this test is to check and see if there's a potential or possible fracture in the body. So were you feeling hurt today?
I'm feeling pain, like right there.
Feeling pain right through there. And so what we're going to be looking for, positive test, is if there is pain at the fracture site, the indicated fracture site. So we're going to go ahead and give our tuning fork a nice little bang. We're going to place it just off of where she's feeling that pathology, and we're going to see if she feels anything as I press it against here. Do you feel anything?
Just vibration.
Just vibration. We'll move a little bit closer to the indicated pathology. How about as I press right through here?
A little bit more pain.
A little bit more
Vibration
pain.
still.
The vibration still? Let's go a little bit closer if you're not quite sure. All right, just a little bit closer.
Yeah,
That one's
I
definitely
feel it.
painful. Okay, well, we're not going to go any further. There's a positive test for a possible fracture there on the fourth metatarsal. Next up, we're going to have the anterior drawer test. And this test is going to be testing for laxity within the ankle, specifically in the anterior talofibular ligament and the calcaneofibular ligament. The way that we're going to perform this test is simply by stabilizing the shank and grabbing the heel and the foot, and we're going to be translating it anteriorly. So we don't want to rotate the foot or bring it into dorsiflexion, but rather just translate it anteriorly. So as we go, you're going to see just a little bit of movement, and that's normal. And then we'll test the ankle that has possible pathology. Typically, we'll start with the one that does not hurt. And then we'll go ahead and do the same thing, just bring it anteriorly. It's about the same, so that would be a negative test. If there was more laxity in one ankle than the other, that would be an indication of a positive test or a possible sprain in the anterior talofibular or calcaneofibular ligaments. Our third test is the clear test. This test is to specifically test to see if there is any pain or if there's a possible sprain in the deltoid ligament. The test will be performed by, again, grabbing the distal end of the shank and then externally rotating the foot. And so as we do this, we're looking to see if there's any pain in the deltoid. So as I press against and externally rotate your foot, do you feel anything? Not feeling anything? All right, sounds good. So that will be a negative test for the Clear test. The last test that we have for you today is the Maddles test. If you'll go ahead and rotate onto your stomach. The Maddles test is testing to see if there is a complete rupture or grade 3 sprain of the Achilles tendon. The way that this test is performed is to bring both legs up to about a 90-degree angle, if you will go ahead and do that. A positive test is indicated when one foot will be dropping into dorsiflexion or a neutral position. And so as you'll see right here, both feet are at a semi-plantar flex state, and there's not one that's dropped further than the other. And so this would be an example of a negative test since they're both in that state. Thank you so much. Have a great day.